Gina's been a registered dietitian at Cancer Care since 2009, and she specializes in providing patients with nutrition education and assessment while they are undergoing cancer treatment. Gina holds a Master's of Science degree in Applied Human Nutrition from the University of Guelph and a Bachelor of Human Ecology degree from the University of Manitoba. She's a member of Dietitians of Canada and the College of Dietitians of Manitoba. Gina's been practicing registered dietitian, for 21 years, and we are delighted to have her speak with you this evening.
Thank you, Lori. And thank you, Dr. Rutledge. That was a great introduction. Hopefully this sort of falls right in with everything you were saying. So one of the things that I want to talk about, of course, good nutrition is really important, and everybody needs to eat, so nutrition is a topic that everyone should be interested in. We get a lot of questions as dietitians here at Cancer Care Manitoba. Of course, people want to be very involved in your care, and it's wonderful to see so many people out here on such a beautiful night. That would be great to be out exercising too, but you can learn a lot by coming to these sessions, so I thank everyone for coming out and giving up their evening. Because everyone needs to eat, we're often looking for ways that we can be involved in our own care and managing our own care. And of course, one of the things we can do is eat well. That being said, there's also a lot of misinformation out there too. And that's one of the things that I want to help sort out for you. I get a lot of questions, as do my colleagues, about, the latest, greatest diet, something that they've heard on the news, something that's come up on the internet, something a friend or a family member has shared, and they want to embark on a new diet or take an herbal preparation. So I'm going to share with you some scientific knowledge on good nutrition versus things that you need to watch out for. So part of my talk today is going to be talking about what I like to just think of really simply as nutrition myths. And I want to debunk some of the most popular myths or some of the most popular questions that we get asked. But I do also want to share with you some great news that there is wonderful research that indicates that there are certain foods in our diet, like Dr. Rutledge was saying, the fruits and the vegetables, and how these can actually help fight cancer. And I want to direct you to some great websites where you can get more information for those of you that are really interested in this topic. I'm glad to hear you saying that nutrition is either number one or number two. I'm a big believer in both exercise and nutrition and meditation, and enjoy things like yoga. So, that's wonderful to hear sort of the same messages that I share with my patients too. And as I mentioned, everybody has to eat, so when we all have to eat, especially when we're trying to eat and stay well during cancer treatment, that does raise a lot of questions. So I thought I would share this that a colleague emailed to me a little while ago. So what are nutrition myths? I think I've touched on that a little bit, but really there's a lot of information that if we combine certain foods, or we eliminate certain foods from our diet, or we follow a special diet regime, or we start taking the supplement that's only $100 a bottle, it could cure our cancer. And wouldn't it be great if that was true and we didn't have to undergo chemo or radiation therapy or have a really aggressive surgery and we could cure our cancer? But we really have to be careful and keep our eyes open, because a lot of these claims are what we call testimonial based. Someone will say, well, my friend or my neighbor or my relative's friend had cancer and she started following this diet or taking this herbal supplement, and you know what? Her cancer went away. But that's part of the story. The other part of the story was that this person also had surgery and also underwent radiation therapy and maybe chemotherapy too. And that is a big part of how the cancer was treated, managed, and went away. So we have to watch out for what we call testimonial information that's passed down from one person to another. So what we do as dietitians, part of our job is to help look at the science and really break things down from a biochemical and a physiological standpoint and how nutrients work in our body, and help educate the patients and clients that we work with so that they can gain a better understanding about sound, healthy nutrition. And honestly, bottom line, there is no one special food or diet that's proven to cure or control cancer. And if there was, trust me, I would be out on the street corner telling everybody about that and handing it out and making sure everybody knew. So the use of special diets is very intriguing, and with the internet, of course, it's even more intriguing because there's so much information out there. And people are well-meaning. Friends and family just want to help, but some of these dramatic results make these types of special diets seem so enticing. You know, there's that belief too that if we take a certain mega dose of a vitamin, I'm going to talk a little bit more about vitamin C, that can have a profound effect on stopping cancer cells from dividing. Patients want to be involved in their care. That's why you're all here and you're here to learn. And sometimes people will embark on these special diet therapies because they think it can help reduce their pain or symptoms like nausea or vomiting or diarrhea. And in fact, some things can. Like, for example, we do have evidence that shows that ginger in the diet can actually help reduce things like nausea, or that certain foods in the diet can actually help minimize diarrhea or alleviate constipation. So in fact, there are certain foods that can do that, but there isn't any one sort of magic food. So some of the questions that I get asked on a regular basis, as well as my colleagues, is does sugar feed cancer? How many people have heard that before? Oh, you shouldn't eat sugar because it feeds cancer. Yeah. I will get into that. Dr. Rutledge did mention that it is not a healthy practice to eat a lot of simple sugars or drink a lot of pop or fruit juice, and I would agree with that. But I will talk to all of you about how you can, in a very safe and healthy way, incorporate foods that have sugar into your diet. Another question is, will taking high doses of certain antioxidant vitamins like vitamin C or vitamin E help cure cancer? And how many people have heard of the alkaline diet? Yeah, okay, so that's another really popular one right now. So there is a belief, and it's quite a common belief, that sugar actually feeds cancer. However, this, if anyone has gone online, I mean, if you just do a quick Google search, you'll get over 100,000 results if you put in sugar and cancer. And when you start reading through that information, and all that screen time and getting confused is probably not a good thing for us, because the information is not only confusing, it's contradictory, and some of it is just downright misleading. So just to try and look at sort of the physiology and how our body uses energy. So all the cells in our body, including cancer cells, use sugar as their preferred source of energy. So our brain, our muscle, our body cells all are looking for sugar in the form of something called glucose as their preferred source of energy. But let's just think about a healthy diet for a minute. If we think of Canada's Food Guide or the 4 food groups, many healthy foods that we need to nourish our body also contain sugar. Things like fruits and vegetables and whole grains and even dairy products have sugar and provide our body with sugar. So how can we still have a healthy diet and eliminate all those foods? Based on the current research that we have right now, we cannot say that sugar actually preferentially feeds cancer cells. But this is what I can share with you. When we do have a lot of sugar and simple sugars in our diets, we're talking about things like pop and fruit juice, what this does is it stimulates our body to produce insulin, right? So if there's a lot of sugar that enters our bloodstream, if we drink a can of pop really quick, there's about 10 teaspoons of sugar in that can of pop. The brain gets a message, blood sugars are high, pancreas puts out a whole bunch of insulin. And that insulin will take that sugar from the blood and push it into the cells. And what that does is it gives the cells energy, or it sort of revs up cell growth. So too much insulin and too much sugar entering the cells at once could possibly encourage cancer cell growth. So I agree 100% with what Dr. Rutledge said. It is wise to limit the amount of simple sugar that we consume. But we do not need to eliminate all sources of sugar from our diet. And there are other little tricks that we can do as well, because there's other nutrients that are part of that mixed, healthy, balanced diet that can help slow down how fast that sugar gets into our bloodstream. So if we have a healthy, balanced meal that contains things like protein, healthy fats, and fiber, this will help cause the sugar to enter the bloodstream more slowly. You'll have less of an insulin response, and you're not really pushing a lot of energy into cells quickly. So the whole theory is that cancer cells divide really quickly. If we give them lots of sugar, they can divide even faster. But if we have a healthy, balanced diet, we're not really giving those cancer cells any kind of advantage. So let's just look at this for a quick second. We've got simple sugar from fruit juice. How many people have ever heard that pure, unsweetened fruit juice contains as much sugar as pop? Anyone heard that? Well, it's true. And grape juice actually contains more sugar than pop. So I prefer to tell people to eat their fruit versus drinking their fruit. So if we now look at that orange in the second little picture there, we've got some simple sugar in that orange, but it's packaged up with a lot of dietary fiber. So fiber slows down digestion. It's going to slow down how fast that sugar gets in the bloodstream. And then we can add in some other healthy nutrients like nuts. Nuts are high in healthy fats and in protein. So when we have that whole orange and we add some healthy fats and protein, now we're getting a nice slow release of sugar in the bloodstream. So if there is an advantage to cancer cells to get a lot of simple sugar, if we eat this way, we're not giving them any advantage. This question is so popular that I did put together an article for a newsletter for cancer care, and in that I sort of do a question and answer and go into far more detail and direct you to some actual websites that give clear information on sugar and cancer, so all of you are welcome to pick up a handout at the end of the session. You're also welcome to jump in and ask me any questions as I go along too. I'm very happy to have an interactive session.
Excuse me, is
Yeah.
that the juice that comes from the store that says it's 100% juice, or is that the juice that you make yourself out of a juice maker?
Again, we actually prefer whole fruits and vegetables versus juicing because you throw away a lot of great stuff like fiber and the peels, where a lot of those good, what we call phytonutrients or health promoting compounds in the fruits and vegetable are. If you like to make your own juice, then have it with other foods at a meal and freeze the pulp to add to things like baking soups and stews so you don't throw away some of that good stuff. Does that help a little bit? So the bottom line is stick with sources of carbohydrate, more complex carbohydrates that contain the naturally occurring sugar, like your vegetables, whole fruits, whole grains, and things like beans or legumes, and avoid those concentrated sources of simple sugar, like pop, fruit drinks, hard candies, and of course we all want to reward ourselves and enjoy dessert now and again, but just limit it to a few times a week and just enjoy a smaller portion. Vitamin C. How many people have been told that if you take a lot of vitamin C, it can fight cancer? Okay, so vitamin C is something that we all need in order to stay healthy. It's a water-soluble vitamin. It's one of those vitamins that is classified as an antioxidant vitamin, and what an antioxidant simply means is it protects cells from death. And it's found abundantly in the diet, and all of our fruits and vegetables, pretty much any fruit or vegetable we put our hands on would have quite a bit of vitamin C in it. Some of the things we do know that vitamin C does is it aids with wound healing, it helps our bodies absorb iron, it helps to generate healthy white blood cells or fighter cells. But just because a vitamin is good for us, more doesn't mean it's better for us. And Health Canada has actually set an upper tolerable level for vitamin C, and that's 2,000 milligrams or 2 grams a day. And if we do consume more than that on a daily basis, we can have some undesirable side effects like nausea, abdominal cramps, and even diarrhea. And some of those kinds of side effects can also take place from having cancer treatment. So if you're taking a lot of vitamin C and you're also having chemotherapy, sometimes it's hard to know what's making you feel sick or have these side effects. If we take a lot of vitamin C, more than the 2,000 milligrams or 2 grams a day, we can also develop kidney stones. So that's not a fun thing to have happen. There are proponents, some naturopaths have recommended to patients that I've worked with to take 10 grams of vitamin C a day, or 10,000 milligrams. That would be the equivalent of eating about 133 oranges. That's a lot of vitamin C. This amount came to light because Linus Pauling, the vitamin C guru, wrote a book in the 80s that was called How to Live Longer and Feel Better. And in this book, he makes a claim that 10 grams of vitamin C actually has the ability to cure certain cancers. So based on this information that was published, the National Cancer Institute and the Mayo Clinic did research and found this claim to be false. So again, what does an antioxidant do? In simple terms, it protects cells from death. But at this point, we can't really say, there isn't enough clinical data out there. It wouldn't be ethical to give people really high amounts of vitamin C. But what we can say is that potentially a high amount of vitamin C in your diet every day, and you're also having cancer treatment to kill bad cells, there's maybe the possibility that you're protecting some of the bad cells as well. So I did a literature search and I looked at the most current data that is available on vitamin C and cancer, and the clinical trials that do look at this have not shown that high doses of vitamin C actually have any anti-cancer benefit. Vitamin E. This is probably the most controversial vitamin when it comes to things like cancer and heart disease and all kinds of things that I've ever come across in my years of being a dietitian. One study will say that vitamin E is fantastic, and then maybe a month later, different flavor of the day, the next study will say that vitamin E can be harmful. Vitamin E is a fat-soluble vitamin. It's found abundantly in the diet as well, in things like vegetable oils, nuts and seeds, whole grains, and in eggs. And it's important for us. It's also an antioxidant, but it's important for central nervous system development. It also protects our eyes, the retina of the eye. But again, if we overdo it and have too much, we can also have some adverse side effects. Often patients will come to me and they've been told to consume about 1,200 international units of vitamin E a day. And we do know that there can be undesirable side effects if day after day you're taking more than 1,000 international units a day. Vitamin E is by no stretch of the imagination inert either, and it's fat soluble, meaning it does get stored in the body and some of our fat tissues. It can interact with some chemotherapy drugs, and it also has a really significant effect on medication that is involved with blood clotting. So it can cause us to bleed more, especially if you're on medication like Coumadin, warfarin, or heparin, things that are designed to control your blood clotting. High doses can actually cause hemorrhaging and bruising, nausea, diarrhea, stomach cramps. I had a patient about a year ago that said to me, I don't know why, and lifted their shirt, I have bruises all over my abdomen. Well, it was because they were taking very high doses of vitamin E, and it was causing bruising.
Excuse me?
Yes?
So you're mostly talking now about vitamin intake, not so much the regular intake through diet.
Right, and I'm just going to move into that.
Okay.
Okay. That is one of the things that we do see, though. We get asked a lot of questions. People feel that if they take a lot of supplements, then it can have a helpful effect, and we just need to caution people that sometimes more than what you'd get from healthy foods can be harmful.
Grains and all the rest of it are okay, it's just
Oh, absolutely.
watch out the supplementation.
Exactly. So if you're getting vitamin E naturally from food, then you're good to go, because you'll never get to that level, even if you're eating the healthiest diet. You'll never be going over 1,000 milligrams. Yeah.
Right, I see, okay.
Yeah. So the alkaline diet, it may sound healthy on the outset. It's essentially a plant-based diet. And plant-based foods like our fruits and vegetables are very healthy for us. But the alkaline diet, unfortunately, is not a balanced diet. It's really inadequate in protein, which is a very key and important nutrient, especially when you're undergoing cancer treatment for healthy tissues and cell division and regeneration of healthy new cells. It becomes that important building block. So the alkaline diet recommends not having any poultry or fish or meat or dairy products, and very little even in the way of whole grains. So it does tend to be an unbalanced diet. The whole belief of the alkaline diet is that cancer cells produce acid. So they like an acidic environment, they thrive in an acidic environment. So if we can somehow change the environment inside our body to be more alkaline, then we can stop cancer cells from being able to thrive. And this theory is true in the test tube. So if we put cancer cells into an alkaline environment in a test tube, they will die. But this theory does not hold true if we take that scientific information and transfer it to what happens in our body. So that really only applies to cells that are isolated in a lab setting.
I'm assuming that's also true for alkaline water?
Yes, well, just to take things maybe into a little bit more of an explanation. When we eat foods in fact are either acidic or alkaline, just naturally. And our fruits and vegetables tend to be acidic, so think of how, acidic an orange might be, again, if we think of some of our citrus fruits and vegetables. But what happens when we eat any food? It enters the stomach first, and there's a lot of acid in the stomach, hydrochloric acid, and that's part of the way we start to digest and break down our food. As soon as foods leave the stomach, so this is just some sort of basic physiology, foods will then become alkaline because a lot of the digestive enzymes that are released into the small intestine are alkaline. Our body very, very tightly controls what we call our acid-base balance. We control it through respiration. The kidneys play a really important role of maintaining acid-base balance. So the only thing that we can really change the acidity or the alkalinity of is our urine, because the kidneys are controlling that. In fact, I don't know if anybody has ever heard of someone having diabetic ketoacidosis, where they have to get rushed to hospital and put on IVs and that in order to stabilize their acid-base balance, or dialysis does an important job too for people that have unhealthy kidneys. It helps them with their acid-base balance. So we can't actually change the alkalinity or the acidity of our cells. That's very tightly controlled by the body. So honestly, bottom line is it doesn't matter whether foods are acidic or alkaline, because there really isn't anything that we can change the acidity of except our urine. So hopefully that gives a little bit of an explanation, because I've had patients that have lost a lot of weight and gone through a lot of effort to try and only eat acidic foods, and really it's been detrimental to them because they've lost a lot of lean body mass or muscle and weight by doing that, and it's made it harder for them to get through their cancer treatment. Okay, so maybe this is the part that's a little more interesting to people, but this is talking about foods that in fact can fight cancer and can help us. And of course there is very strong evidence, as was mentioned by someone here tonight, that really a balanced diet that's filled with a variety of foods, including plant-based foods like vegetables and fruits and whole grains and beans, like legumes, can actually help reduce the risk of many cancers. But what we're really finding is it's not a single nutrient or a single food or a single pill or herb, it's that synergy or the compound or the food matrix working together in the overall diet that offers us the greatest protection against cancer. So the American Institute of Cancer Research puts out a lot of great information. It's one of the recommended websites. I have a sheet that will give you a lot of good websites that you can go to for sound, credible nutrition information. They're always coming out with very current research updates. And so they're talking about right now, foods that are high in fiber. We have good evidence to show that can help reduce the risk of colorectal cancers. A diet higher in fruits can help reduce the risk of certain other cancers. Foods that contain vitamin C naturally can help reduce esophageal cancer. So that's some of the current information you can find on the American Institute of Cancer Research website right now.
I have a question. So how does it help reduce the risk of cancer?
Well, there are many compounds, so especially looking at our plant-based foods, and that's what I'm going to focus on now. What they've been able to do is they've been able to isolate more than 2,000 different compounds in plants. We call them phytonutrients or phytochemicals, meaning plant-based compounds. So if you think of a plant, it survives in nature, it grows in spite of maybe pests or harsh conditions. So we know that plants have a lot of these compounds themselves that help keep them healthy and alive. And then when we consume those, there is some research that's showing that some of those compounds in plants can actually help our cells stay healthy. So one of the big groups of nutrients is sort of what we call the berries and the cherries. So if we look at, I've just pulled a few foods, and there is much more out there if you go to some of the credible websites that I've listed that you can get more detailed information on, but this is just sort of a little overview. So if we look at things like strawberries and raspberries, how many people have been told to have a colorful diet? Have as many colors as you possibly can in your diet. And that's a great plan because that gives your body a lot of these different compounds. So it's a lot of the colors they're finding in our different plant-based foods that really exhibit disease-fighting properties for cancer, but other diseases too that can afflict us. Inflammatory diseases like cancer, like heart disease. So strawberries and raspberries are rich in a certain acid. I'm not going to say some of these names. They're big words, ellagic acid. They found that when they look at this and study it, it can actually slow down the reproduction of cancer cells. So specifically looking at certain types of cancer like skin, bladder, lung, esophagus, and breast. Blueberries are one of our most potent food antioxidants, meaning that they help keep cells healthy. And scientists believe that they are one of the most potent that's been discovered yet. So eat your blueberries. Frozen is as good as fresh because we can't always get access to a lot of those fresh fruits and vegetables, or the cost can be prohibitive living here in Winnipeg in the winter. And we know that when fruits and vegetables are frozen quickly, that they maintain a lot of those health benefits. You had a question?
Yeah. I was eating a lot of berries, and then someone told me, what about the pesticides? That strawberries were #1 with pesticides.
Yeah, when we look at that sort of dirty dozen, well, I think the bottom line is wash your fruits and vegetables as well as you can, lots of water. You can put a little bit of baking soda in water and put them into a bowl with some baking soda and sort of give them a little scrub. There is something that's called a mushroom brush, and you can use that to scrub your fruits and vegetables. That helps. And I guess when we sort of look at the pros and the cons right now, we could definitely say the research indicates that you're still better off eating more fruits and vegetables in spite of some of the residues and pesticides of that might be left on fruits and vegetables. So you're still better off to eat your fresh fruits and vegetables. And the question of organic versus non-organic, again, when they do study the organic produce, it's really not showing that it exhibits a lot more health benefits at this time than your conventionally produced fruits and vegetables. And sometimes the cost makes it so that we can't afford as many different fruits and vegetables if we opt for organic. So again, we can't say with the research we have at this time that it's worth buying the organic. I mean, pesticides and herbicides are everywhere. They're in our water system. Honestly, we can't completely avoid them. Apples, there's a lot of great research. The old apple a day keeps the doctor away. So there is a lot of important compounds in apples. People ask me if they should get rid of the peel to avoid the pesticides. But there are some really neat compounds, something called quercetin that's found in the peel that really has a lot of health benefits. And there's even some very good pectin, a type of fiber that's in the inside of apple. If anyone's ever made crabapple jelly, you don't have to add any of that Certo or store-bought pectin because it gels right up. And that's a major type of fiber that's in apples, and it's found to protect colon cells because it kind of helps soak up some of the toxins in the large bowel. So eat the whole apple. Give it a good washing. I think one of the most talked about phytonutrients is probably lycopene. It's become a household word. People have heard of lycopene before? Yeah, we find high amounts of lycopene in tomatoes, and we do have great evidence that shows that it can actually help reduce the incidence of developing prostate cancer. You can even help reduce the progression of prostate cancer. So something about tomatoes and lycopene is, I made lots of homemade tomato sauce this year. I try and do that every year, and we had a pretty good crop of tomatoes. Do you notice if you've ever made homemade tomato sauce that it starts out pink, you blend up your tomatoes, and as you cook it, it gets redder and redder? And that's because the lycopene is being released from the cells. The cells are splitting open and letting the lycopene out, and when you add a little bit of olive oil, it makes your body better able to absorb that lycopene. So lycopene content increases in cooked tomatoes. One of the questions I get asked a lot too is a raw diet good? I should follow a raw diet, right? We should eat fruits and vegetables and foods in a variety of different ways because we get different nutrients that way. So if we eat a tomato raw, for example, we're going to get a lot of natural vitamin C. If we cook a tomato, we're going to get a lot more lycopene. If we eat, for example, broccoli raw, we're going to get a lot of vitamin C. And if we cook broccoli, we're going to get a lot of a disease-fighting compound called chlorophyll that will be more accessible to us. Same with carrots. If you cook a carrot, you get a lot more of that beta-carotene, right? That helps our eyesight. So eat foods in a variety of ways and a variety of foods. Go ahead.
My naturopath actually told me to stay away from tomatoes and broccoli because breast cancer, it creates estrogen. Any comment?
And you know what, that is a really good question, that there's certain foods that are pro-estrogen or foods that even contain what we call phytoestrogens or plant-based estrogens. And I'm going to talk for a second about soy. And the latest research shows that actually they can be cancer protective. Yeah, so you should enjoy those foods.
I don't know if this is the place to ask this, but
Okay.
I wanted to ask about a low glycemic index diet.
Yeah.
Which eliminates a lot of vegetables and fruits that you said were very nutritious, like carrots and potatoes have high glycemic indexes. What about a low glycemic index diet and its health and nutritional qualities?
Low glycemic index, that is a really good question. Low glycemic index foods are healthy. We do consider whole fruits typically lower glycemic index because of the fiber. Vegetables would be lower in their glycemic index. What glycemic index means is just how fast a food, if it does contain natural sugar, how fast that sugar is released into the bloodstream. So we do encourage low glycemic index foods. With potatoes, if you eat the peel, if you choose red potatoes over white potatoes, they're going to be lower glycemic index. And really, bottom line, it gets down to that mixed diet. So you could even take something like a white potato that's peeled to make mashed potatoes that would up the glycemic index compared to a red potato that you ate with the peel. But if you had a protein-rich food, like let's say some lean fish, and you had a little bit of olive oil on a salad, now your white potato has become low glycemic index anyways, because those other foods, the fat, the fiber, and the protein have slowed down So that's why people get a little bit, some people really believe in glycemic index, whereas other people don't hold as much, faith in it. I worked in diabetes education for a number of years, and we would encourage the low glycemic index options because most often they were healthier. So for those people that like to consume and watch for the lower glycemic index choices, that's a great way to go. Yeah. And things like, fiber, like the pectins and that, or the winter squash that would have a lot of that good soluble gelling fiber would be low glycemic index. And winter squash, we can get that now. I've been making squash soup. It's loaded with beta carotene and the alpha carotenes, of course. These are important nutrients for healthy eyes, for immune function, and they do help us to maintain healthy cell division, not unhealthy cell division. So they are cancer fighters. And then here's the question about some of those phytoestrogens like soy. So it's not something that a lot of us, unless we've been introduced to soy early in life, that we tend to embrace or have a lot of in the Canadian diet. But soy comes in a variety of different forms, like tofu, tempeh, edamame beans. I enjoy those. Soy milk or beverage and miso. They contain some important compounds that help to regulate healthy cell growth and destruction of abnormal cells. So there has been a lot of current research. Go on to the American Institute of Cancer Research and you'll have some really good information and research on soy, the latest, greatest. Soy does contain those estrogen-like compounds, and there has been fear that the soy can cause an increased risk of hormone-related cancers, but the most current evidence shows that this is not true. So go to that site and look into that a little further to give yourself some reassurance and comfort about being able to enjoy some of those healthy foods that you've maybe been discouraged from having. Dry beans, one of my faves, because again, you can do so many things with them, and they're economical, and they're an environmentally friendly crop to grow because they take nitrogen from the air instead of from the ground. And they're just a nutritional powerhouse. They are low glycemic index because they're high in fiber, they have plant-based protein, and they're found to reduce a number of cancers. They're also high in something called folate, my nutrient of choice. It was what I studied for grad school, but it plays an important role in healthy cell division and helps repair damaged cells, and legumes are a great source of folate. Garlic. So garlic has been used for all kinds of things over the years. Garlic capsules that have been deodorized really don't show any health benefits. So actually eat your whole garlic, and the best way to have garlic for having the most disease-fighting compounds is to add it at the end of cooking, so you don't cook the heck out of it, or eat it raw, because it is shown to have some really good antibacterial, antiviral, as well as anti-cancer effects. So I think this is all about informed decision making. You guys have asked me some fantastic questions, and I'm sure there's more, and there's probably a lot I can't answer. Nutrition is still a new science. We're still learning about it every day. That's what keeps me so interested in it. It's never the same thing twice. There's always new information. There's always new things to learn. And of course, when we do embark on a certain diet or a healthier diet, the intent is for those positive health benefits, but we should keep our eyes wide open and be aware that there is potential for some negative side effects, especially when we're opting for things like herbs or mega doses of vitamins. So bottom line is the nutritional choices we make can have a very potent effect on our body, and we want to make the right choices to have a potent positive effect on our body. I am very happy to answer more questions. I know Dr. Rutledge has...
Stay
there? Okay.
Yeah, it's such a great talk, so thank you so much. I think we should have more nutritional questions now.
Sure.
If you would, go for it.
I'm just wondering if you recommend taking any vitamin supplements? If you're eating a healthy diet, then should we be also taking supplements?
She stole my question, so I'll just repeat it as well.
All right.
I thought that your brain function is better if you get your vitamin B, and we probably don't get enough vitamin B in our diet, but now over to the expert. Do you recommend a multivite or not?
One thing that is very safe is to take a well-balanced, complete multivitamin. Pretty much during any cancer treatment, that is safe. And the reason it's safe is because you're getting all of your vitamins and minerals in very small amounts. And sometimes during cancer treatment, our appetite isn't as good, and we aren't able to eat such a great variety of foods just because of how we might be feeling. So adding in a well-balanced, complete multivitamin is really a good way to go. You're not going to get any one nutrient in overly high levels. B vitamins are pretty abundant in the diet. We don't typically recommend a B vitamin supplement unless there's some reason, like someone has been told or found from lab work that they have a low vitamin B12, then we would recommend supplementing with that so they don't get anemia and feel even worse during treatment. But that being said, you know, a B complex, there isn't any antioxidants in a B complex, and it certainly shouldn't interfere or cause any harm with cancer treatment. It's also water soluble. We don't tend to store B vitamins. One supplement that, living here in Canada, because we're above the 40th degree latitude north, and by the end of October until the end of March, sadly, we aren't going to have the nice sunshine that we do the other months of the year, so we should all be supplementing with vitamin D. It's a supplement, if we're going to stay living in Canada this far away from the equator, it's a supplement we need to take from birth to death. The Canadian Cancer Society recommends 1,000 international units of vitamin D per day. Health Canada has just revisited vitamin D and made some new recommendations, and the new upper tolerable level is 4,000 international units in a day. We should not exceed that because there could be some potentially negative health side effects. One of the things vitamin D does, it's a helper vitamin. It helps our body absorb and use calcium, and we don't want to take so much vitamin D that we're starting to possibly deposit calcium in muscle tissue. So that's why there's the upper tolerable level of 4,000 international units a day. We don't get a lot of vitamin D in our diet. It's not abundant in our diet. It's found in very few foods naturally. Most of our vitamin D is actually created from the UVB synthesis of the sun on our skin. But again, from October to the end of March, we can't make vitamin D. Inadequate levels, the rays of the sun just simply are not strong enough. So we do get natural vitamin D from egg yolks, a little bit from margarine, and from some of our nice fatty fish like salmon. And of course, dairy products. In Canada since the 60s, our dairy products like our fluid milk and our skim milk powder has been fortified with vitamin D, and that was to prevent children from developing a bone deforming disease called rickets. We only get 100 international units of vitamin D in each 8-ounce cup of milk, and now some yogurts are fortified with vitamin D, but it does not occur naturally in dairy products, and it's not in things like cheese, and it's not in all of our yogurt. So I think the best way to go is to just take 1,000 IU a day.
Wonderful. Go
Yes.
for it.
Hello.
Hi.
Hi.
B12, what's the limit on that?
You know, I'm not sure of the upper tolerable level. You could check the Health Canada website. I don't have them all stored in my brain, but I think 400 milligram dose is safe for anyone of B12. Yeah. Yeah, it's pretty, any animal-based food has B12. So even if you're a vegetarian but you consume dairy products, for example, or you consume eggs, you're going to get B12. It's pretty abundant. Over the age of 50, though, we do tend to absorb a little less B12, and that's why some people say, well, I'm eating foods with B12. I'm not a vegetarian, yet my B12 is low. We need something in our body called intrinsic factor to absorb B12, and a lot of times, just with age or with some illnesses, we make less of that intrinsic factor, so we can't absorb it from the diet as well. And then there is a common medication that people can be put on. It's a type of antacid called Losec or omeprazole, and it actually stops your body from being able to absorb the B12 from food, so then you do need to take a supplement, and what we usually recommend is a 400 milligram supplement of B12 daily for those individuals on that medication. But as far as the exact recommended daily amount, sorry, it's my aging brain. More questions?
Can you comment on omega-3?
Yeah, that's another nutrient of choice. Omega-3 fats, that's kind of become a household word. I think most people have heard of them. Yeah. We get omega-3 fats from a variety of foods. They are an important fat. They are important for reducing inflammation, for boosting immune function. They're important for brain and eye health. There's 3 main types of omega-3 fats in the diet. How many people have heard of ALA or alpha-linolenic acid? That's an omega-3 fat that we get from our plant-based foods. Things like flaxseed, canola oil, soybean oil and walnuts are very high in omega-3 fats. I was actually going to talk a little bit about walnuts for the omega-3 when I was going through my food list, but I just knew I'd be running out of time. So it's our essential omega-3 fat, meaning our body cannot make it. We do need to take it in. We do need it to prevent essential fatty acid deficiency. We need it for adequate brain function. And when we do take in the plant-based omega-3 from things like soybean oil or ground flax, our body will convert small amounts of that omega-3 to the other types of omega-3, the other two main, the DHA and EPA. Have people heard of those? Those come in our fatty fish. When we're really looking to reduce inflammation, to improve heart health, to reduce things like triglyceride levels, we really should go right to those fats, the DHA and EPA forms of omega-3, the dicosahexaenoic acid and the eicosapentaenoic acid. Those are really big mouthfuls, because those are the fats that are shown to have the most potent anti-inflammatory effects. We only convert really small amounts of ALA to DHA and EPA. It's only about a 4% conversion. So if you're looking to get enough omega-3 to really help reduce inflammation, then you should look at taking maybe a fish oil supplement or follow Canada's food guide and have 2 servings of fatty, oily fish a week, like salmon, herring, mackerel, tuna, or trout as some of our most oily omega-3 rich fish. Yes?
Is there any foods to avoid other than the obvious of processed foods and fast foods and sugary foods if you have cancer?
Foods to avoid.
Foods to avoid, yeah. I think that if we would all benefit to avoid a lot of those highly processed foods. You can use a little rule if you're looking at an ingredient list. If you can't pronounce an ingredient, you probably shouldn't be eating it. That's one way to check something. Yeah, it's a great idea to go back to sort of the basics and eat our whole foods. And I mean, we can't completely avoid processed foods, but if we can try to minimize the amount, and not all processed foods are unhealthy, like pasta is a processed food, and you can buy the multi-grain pasta, or canned tomatoes with no sodium added or processed, yet they're healthy. But yes, things that have a whole chemical list that we can't even pronounce, then we should try to avoid those things whenever possible. Sometimes when we're fatigued, when we're undergoing cancer treatment, we might opt for some frozen or convenience things that maybe have a few of those unpronounceable ingredients, and sometimes we just need to do those things to get through a little window of time when we're too fatigued. So I hate to label foods really as really bad, or you know, you have to kind of do what you have to do and then try to fit in some of the other healthy things around maybe some of those convenience items.
But is there any real foods, I guess, that one should avoid, like beef?
Yeah, we do get the question about red meats, and you know, small amounts of lean red meats I still believe are a very important part of a healthy diet, because they can help us get iron and a lot of other trace minerals, and they're a great source of protein. But there's the one food or group of foods that I would suggest not eating, much to my 2 teenage sons' chagrin, is bacon and other processed foods, because they are loaded with a preservative called sodium nitrate that has actually been classed as a carcinogen. And sodium nitrate is still added to processed and smoked meats, things like bologna, salamis, pepperonis, and that's because the foodborne illness from those products spoiling is far more detrimental than is felt than the sodium nitrate, the small dose that you might get. So really limit those things or make them a treat food. And then of course, I don't think, I mean, certainly if you want to consume some ginger ale because you're feeling nauseated and it's helping to settle your stomach, then certainly we advocate that. But there is certainly no reason to constantly be having a bottle of sugar-sweetened pop in your hand or be drinking excessive amounts of fruit juice.
How about barbecued meat?
Charred meats, yeah, that's another one that comes to mind. So yes, you can still grill and barbecue, but try not to catch things on fire. Typically, if you purchase leaner quality meat that isn't high in fat, you don't get as much dripping onto the flames or the coals or onto the barbecue grill, and you don't get the flames, so you don't tend to get things charred. Yeah.
A lot of people take, drugs like omeprazole or like the proton pump inhibitor.
Yes.
I've never heard pharmacists ever mention.
About the B12?
Yeah.
Yeah, it's true. I know, it's not It's probably not as widely, I know not all pharmacists will put that little sticker on there or do that patient education, but they should be.
I've never seen that. I've never-
Yeah.
Actually, in like the information sheets, I can note for.
Did you,
as well.
did you see that in the information sheets you're saying?
No, but-
No? Oh,
Maybe, no.
should be. Yeah.
Is there a difference between buying your supplements from like Costco and getting them at a health food store?
Yeah, that's a good question. Well, one big difference is the price, typically. Look for, when you are purchasing, this is the best advice that I can give all of you, is that when you are purchasing a natural health product, like for example, a multivitamin, drugs that we purchase in Canada, if we go to the pharmacist and get a prescription filled, they'll have something called a DIN number on them, a drug identification number. There is now something on natural health products called an NPN, a natural product number. And look for that on any of your supplements. If you're going to go and buy an omega-3 supplement, 1,000 milligrams of an omega-3 would be healthy for many people, not everyone. You need to always check because, again, it could be a blood thinner. But I'm just using that as an example because we know that those omega-3s, for example, a lot of them come from fish oils. Well, we don't want to get the toxins from some fish oils, so we'd want to look for a product that would have an NPN number on it, a natural product number. And what that means is Health Canada has scrutinized that product for safety and purity, and what they're claiming on the package on the outside is actually what you're getting inside the tablet. We do have something called the Natural Health Product Directorate. It is a branch of Health Canada. It was formed January 1st, 2004 to protect Canadian consumers specifically from natural health products, because pretty much all kinds of things were coming into the country and all kinds of claims were being put on natural health products. So if a natural health product does not have an NPN, I would discourage you from using it because it has not been scrutinized by Health Canada. It doesn't mean that it's not safe, it just means it hasn't been tested yet for its purity, its quality, its consistency from what's on the package to what's inside the product. And right now, the Natural Health Product Directorate has about an 18-month backlog. That's how many products they're still trying to analyze. Yes. Questions?
Stay up here.
Your turn.
No, this is just too good. I really, really appreciate this. Okay, so I'm going to try to explain a theory of how antioxidants work.
Good.
And you can correct me. How about that?
We can share.
So part of what causes cancer is that you go from a normal cell to an abnormal cell. It takes dozens of mistakes in order to get there. And those mistakes are usually in the DNA, the words and sentences that tell the cell what to do. And the oxidants are like chemicals that go in and kind of damage the cell. And you don't want to have ongoing damage. You don't want to have damage going from a slow-growing cancer cell to a fast-growing cell. You don't want that process to keep on going. And so when you have the healthy diet that Gina's describing, the antioxidants go in and kind of mop up the chemicals that are causing the damage. Mm-hmm. So did I get it right?
Mm-hmm, I like that, yeah.
Okay.
I think so, I'd say so. Or we say that one of the jobs of antioxidants is to keep cells healthy, to protect cells from death. And so what we're aiming for is keeping all of our cells healthy to stop that abnormal cell division. But of course, we're all exposed to things, like you were saying, pesticides that we can't avoid even if we try and eat the healthiest diets, or herbicides, or oxidative stress, or just stress that our body undergoes. Like exercise is great for us, but it stresses our bodies, it stresses our cells, and it can cause some oxidative damage. So when we come back from our run or our exercise or our yoga class, we should try and eat something healthy that has our protein but also has those good antioxidants that can help ensure that we can mop up those bad compounds in the body and keep all those good cells good and healthy. Yeah?
Good. Stay again.
Okay. I'm not going anywhere.
This is back and forth. And you guys can pop in questions as well. So one of the things that we teach during our weekend retreats and in our seminars and so on is something called mindfulness. Essentially paying attention to the here and now with kind of non-judgmental perspective. And so one of the concepts that I like to bring into the whole nutrition thing is to be able to actually listen to your body. What does it feel like when you're eating the food? What does it feel like an hour later? What do you feel like 3 hours later? And so we all have foods that feel good to our body. So for instance, I really like the combination of fish, brown rice, and salad. That's what makes my body feel strong and healthy. I just wanted to give you that idea and then let Gina talk about mindfulness and when can we listen to our body and so on. So.
Yeah, I think it really is important that we listen to our body. We should definitely eat when we're hungry. We should listen to our body signals and stop when we're full. But sometimes, especially during cancer treatment, when we might be under a lot of stress or even with a cancer diagnosis, sometimes those signals get a little mixed up. Some people probably, and many people tell me every day that they don't have their normal appetite and they can lose their appetite. And so sometimes we have to take our mind
Yes.
and override some of those signals, and sometimes food has to become like medicine during a period of time. And so, it's not the way we always want to eat, because we want to enjoy food. We want to be able to select those healthy foods. My fave would be granola that I make myself with a lot of different whole grains, a high probiotic yogurt topped with a whole bunch of different berries. That would be one of my faves. So you're getting a nice combination of some protein, some good health-friendly bacteria, some calcium. But anyways,